New technology in our area treats breast cancer in only 1 day. We'll tell you if that means saying goodbye to weeks of radiation.
After breast cancer patients had their tumor removed, radiation therapy is often required to reduce the risk of the tumor returning. Now, this can involve coming in daily for weeks at a time. In tonight's Avera Medical Minute, Tess Hedrick explains how electron-based intraoperative radiation is different than standard radiation therapy and how it benefits patients.
Well, we have patients that live all over South Dakota and the other states. They're driving every day to come in for radiation.
Breast surgeon Dr. Julie Ryland says electron-based intraoperative radiation therapy can take away that daily back and forth for breast cancer patients.
But when we do this in the operating room, they come in for their surgery, they get their radiation, it's a 2-minute treatment. They're asleep the whole time, and they're done with their surgery and their radiation in 1 day.
In IORT, the patient receives a high dose of radiation therapy during their lumpectomy.
Well, we know that when a woman has breast cancer and when we take out that lump, her chances of having cancer cells in the area are highest within 2 centimeters of where that tumor originally was. So instead of radiating the whole breast and putting a woman through 6 weeks of radiation every day for 5 days a week, we're now giving radiation just to the area where the cancer was. And we're destroying any cells that may be in that area where the highest risk for residual cancer is.
The American Cancer Society estimates that there will be 276,000 new cases of invasive breast cancer, which will occur among women in the U.S. this year. Additionally, an estimation of 68,000 non-invasive breast cancer, the earliest form, will occur among women in 2020. Finding and treating breast cancers in the early stages can oftentimes lead to a cure. Following a treatment option of lumpectomy or partial mastectomy, time requirements and travel distances required for a patient's follow-up radiation therapy, along with added costs, prove challenging to many women, sometimes so burdensome that some patients shorten or even stop the radiation treatment. A new advancement in breast cancer radiation therapy, called intraoperative electron radiation therapy, or IOERT, may help alleviate some of this burden for women with early-stage disease. Intraoperative electron radiation therapy provides a significant boost to the quality of life to the patients with early-stage breast cancer.
Welcome to Radiation on Demand. ROD is dedicated to bringing mobile technology to you, providing radiation at the time of surgery for breast cancer patients. This single dose of radiation during surgery, commonly known as IOERT or intraoperative electron radiation therapy, is performed in less than 2 minutes, treats the tumor bed, and replaces up to 35 radiation doses at an outpatient radiation center after surgery. This time-saving, life-saving treatment can now be delivered locally to your community, facility, and physician for the convenient and efficient treatment of breast cancer. This technology is fully approved by the FDA and all radiation therapy experts agencies and has been in use for more than 15 years for various types of cancers. Professionals are very confident about its usage and outcomes.
The standard treatment that we would use prior to having intraoperative radiation would be a woman would come in day 1 for a lumpectomy and a lymph node biopsy. That's usually an outpatient surgery, so she'd have her surgery, she would recover from her surgery, she'd heal her wounds for about a month, and then she would start 6 to 7 weeks of whole breast radiation.
What's entirely different now and what we're going to offer is that for some women, they'll have the capability of having that 7 weeks reduced down to 1 day. And that 1 day will be in the OR at the time of lumpectomy. Not only are we reducing the time, we're also reducing the treatments to normal tissue. And that treatment includes the skin, the chest wall, the muscles underneath, the lung, the heart, and anywhere else photons can travel while we're treating from the outside. And I think that's the key for women. Minimize their normal tissue injury and get them home as quickly as possible.
So we would do the lumpectomy surgery in a very traditional way. And once the cancer's been removed, we bring in the linear accelerator machine right into the operating room while the patient's asleep on the table. We bring the electron device right into the surgery and we deliver the radiation into the wound where the cancer was. That treatment takes 2 minutes and it's directing radiation treatment right at the lumpectomy site.
Main cosmetic benefit is that we're not going through the skin. So the radiation is delivered directly to the surgical cavity. That means no skin changes for women, no fibrosis or scarring, no hardening of the skin or the tissue underneath it, and the appearance is just as if you've had that lumpectomy with that small scar, and that's it.
World-renowned radiation therapy organizations such as ASTRO and ESTRO and respected surgeons, members of the American Breast Surgeons Organization such as ASBS, have participated in establishing the protocols. We at Radiation on Demand, or ROD, are focused on breast cancer patients as we feel that this has the best impact for efficient treatment and immediate return to normalcy in the life of active and progressive women. Radiation is part of the normal protocol, but IOERT is a single dose of radiation at the time of surgery, and it saves the patient of going through 5 to 7 weeks of daily radiation trips. Just the thought of a single dose replacing up to 35 doses makes for a better psychological and lifestyle outcome.
I am going to be a 5-year survivor this month.
Sherry Baisley was one of the first patients at Avera to receive intraoperative radiation therapy.
I think for me, just the technology, just new technology. I'm also involved with Susan G. Komen, so knowing that research, advances what happens. My mom's a survivor, so I know what she went through 20 years ago, and it was brutal, and how different the treatments have been.
The treatment is just so unobtrusive. I was the same the next day, the day after surgery. I felt the same energy, well-being, health that I did the day before the surgery. So I just think the treatment is so special because it gives people an option. One size does not fit all.
Choosing treatment options for the cancer patient is always very challenging and difficult. However, being aware of all of the options available with the best efficiency, efficacy, and outcomes is the primary goal of all patients. We at ROD are dedicated in supporting your decisions and providing you with clear information and comparison studies that have been vetted out by the professionals on a worldwide basis. For further information and additional testimonies, please explore our website www.radiationondemand.com. You are welcome to contact us for any information by emailing your questions to info@radiationondemand.com.